Hello, my name is James McDougal. I'm the director of the school psychology program at SUNY Oswego. That's where I'm speaking to you from. First, I'd like to thank Gary Schaefer for inviting me to do a little talk around progress monitoring and screening for students with social, emotional, and behavioral concerns. I'm really interested and excited about Gary's work, and the manual he put together for multi-tiered systems of support is going to be a wonderful resource for practitioners doing that work in the schools. First, I'd like to introduce myself a little bit. I am the director at SUNY Oswego of the school psych program, as I said. Prior to that, I worked for 12 years on and off in Syracuse City schools. I was a school psychologist in an elementary and high school level, and also served in the role of a mental health coordinator for the district for 43 schools and programs in Syracuse, a very diverse student population. And the bulk of my job was in consulting on kids' behavior problems and trying to infuse mental health services into the schools. So in that piece of my role, I help nonprofit organizations in county mental health put therapists into schools to do school-based mental health services. And at that time, which was the late 90s, I was very interested in a measure to indicate whether or not students were benefiting from those services. So I wanted to screen students for mental health concerns and behavioral problems. I wanted to provide services to them, and I wanted to progress monitor their intervention. And also to do program evaluation to see if there are different sites or providers that were better than others. At that time, there were no measures that were suitable for that use. And so I began a 15-year search, or in this case, a 15-year development or evolution of a measure that would do that. And what we're looking for is a curriculum-based, is something parallel to curriculum-based measurement that would allow us to screen, progress monitor, and know whether or not services that students were getting were making a difference. And so I'll talk to you about that process. I'll talk to you about the measures that we use and what the characteristics of those measures are like. And I'll also talk to you about the BIMAS, which is the Behavior Intervention Monitoring and Assessment System. And that's a measure that I put together with a couple special colleagues. And I'll talk to you about that in some depth. First of all, I wanted to talk to you about why traditional rating scales are not effective for screening and progress monitoring. As you know, if you have a background in curriculum-based measurement, which most folks do, the DIBELS, Ames, Webb, and now some of the computerized measures like STAR and so forth, they share common characteristics that allow them to screen and progress monitor. One, they're brief because they have to be repeatable. We have to be able to repeat their administration over time. A large standardized measure won't allow you to do that. They also have to be sensitive to change. Large measures that are diagnostic in nature are by design not sensitive to change. They have very high reliabilities, which, as we know, means that if you give repeated administrations, those measures are likely to stay the same. So measures for progress monitoring and for screening need to be brief, they need to be repeatable, and they also need to be validated and sensitive to change when it occurs, and not sensitive to change when it does not occur. So traditional rating scales are fine for diagnostic work, and that's what they're designed for, but they are not well suited for screening and progress monitor, which is required in a multi-tiered systems of support. So I embarked on a journey. I didn't initially want to design the CBM of behavior and social emotional functioning, but that's what turned out. And so in this journey, I picked up a couple other colleagues. So our collaboration began with me being introduced to Scott Meyer, who was on the far right. And Scott had, for many years, worked to design a model for identifying items on behavior rating scales that were sensitive to change. He had a 9-step model for intervention item selection rules that allowed him to do that. And he had a fund of research where he had, over the course of a decade, he had identified items that were sensitive to change when students were being intervened with, and it didn't seem to change when students were not intervened with. I also met up with Achilles Bardos. Achilles is, his specialization is the creation of psychological tests. He has a number of tests that he's authored and co-authored, and he has very high expertise in the psychometrics behind creating good psychological measures. So This collaboration allowed us to eventually create a measure that we're comfortable does screening, progress monitoring, and program evaluation in realms of social emotional functioning and behavior. So I won't go into a lot of depth in Scott's model for selecting items, but the central philosophy of intervention item selection rules is that the intervention-sensitive items who change in response to an intervention and behave in a theoretically expected manner in other conditions, and then remain stable over time when no intervention is present. And so these items needed to be tested repeatedly in the field and shown to be both valid and reliable, but also change in response to treatment when change was expected, but not change in response to no treatment when no change was expected. Based on Scott's model, we developed the BIMAS, the Behavior Intervention Monitoring and Assessment System. This is the second version, BIMAS 2. It is very much improved in terms of the programming that's involved in it, and it's all completely computer-based. It allows districts to screen their entire district or their entire school or entire cohort of kids, and also to identify students that are at risk, to identify them for intervention, to progress monitor their intervention, and also to do program evaluation in terms of did the students in general respond to one type of group or another, or to special education services. The format of the BIMAS, we had multiple informants, and we standardized the form of the parent, teacher, and self version for ages 12 through 6. We also have a clinician version, which is not standardized, but it's very much similar to the teacher version. The BIMAS has 34 items, which is brief for a behavior rating scale, if you compare it to some of the other more popular diagnostic scales, and allows it to be periodically administered over time. The BIMAS rating scheme is a 5-point Likert scale from never to very often, and includes items that looked at was the individual able to share their thoughts, behave differently than peers, and so forth. The scales in the standard form, the behavioral concerns scales include conduct, which taps externalizing like behaviors, negative affect, which taps anxiety, kind of depressive realms, cognitive attention scale, which looks at inattention, lack of focus, and also atypical thinking. We also had 2 adaptive scales, the social and communication scale, which taps the student's ability to socialize and to communicate with others, and the academic functioning scale, which taps their school functioning. In addition to the standardized 34-item scale, the BIMAS includes a bank of items called flex items. These items would be available for individual student progress monitoring, and they're more informal items. So each standard item has a number of flex items that would be related to that standard item. For instance, if a student appeared angry, then this would tap in 10 or 12 different ways, types of anger: anger towards peers, anger towards teachers, anger towards authority. And it would allow clinicians or interventionists to create 3 to 5 item individualized treatment types of measures that would be periodically administered, perhaps weekly. And then when change was assessed by the interventionist and or the teacher, the standard scale could again be applied to look in a standardized way at the effect size or the relative change index to look at the amount of change that the student actually did exhibit. So the flex it essentially allows you to customize a measure for each of the students they're being with. The psychometric properties of the scale, the standard scale, we had a large normative sample. We had close to 5,000 students that we did the standardization with. We included a number of clinical groups in addition to the normative groups, and we standardized the teacher, the parent, and the self editions or versions of the BIMAS. The reliability, both internal test, retest, and iterated reliability, our coefficients are generally in the 0.8s, 0.85. Again, they're not as high as some of the diagnostic measures, and that's by design because we wanted this measure to be sensitive to change. They are, however, high enough for screening and progress monitoring. They're well within that realm. The validity was very high, and it did correlate well with diagnostic measures in terms of the screening. And it had a good ability to change, and it showed really good sensitivity in terms of classification rates, in terms of identifying clinical populations and separating them from control. My contact information is here. I'm available at McDougal, which is McDougal at oswego.edu. If you want more information on the BIMAS too, please be happy to, we welcome you to visit the new BIMAS website, which is www.bimas2.com, or email Achilles Bardos at help@edumetris.com. Achilles has set up a program where clinicians and school-based supervisors, school-based folks, folks in training programs can request a free trial, and he'll allow you to use the BIMAS for a course of time for free. He also has brochures and so forth. We're really happy that measures now of change sensitivity are being used for progress monitoring, for screening, and also that the clinicians and school sites and counselors are increasingly interested in valid professional measurement of students in terms of social emotional functioning and behavioral health. If there's any questions or comments that you would like to direct to me, I'd be more than happy to answer you by email. Thank you very much.